with the cervical cancer. So from the story, we can know how big the impact of cervical cancer and also the magnitude of the problem of cervical cancer. It's not only about number, but I think we can also consider what happened if if someone or if a lady of a woman affected by cervical cancer is not only affect her or she, but is also affected for the family. Please read the story first. Yeah. Yeah. Please click again, Ibu Arina. Is there any comment from student about this story? I would like to invite the comment from the student. How about your feeling after read the story in the yellow box and the story in the blue box? Please, the students. Please share your comment. Yeah. Okay. The student from UiTM, please also share your comment after you read this story. No one? No one want to express your feeling or your comments?
I feel very sad, doctor.
Yeah. Why?
Because the lack of awareness has caused a lot of people to suffer, and it's supposed to be our responsibility to make them aware of it, but we have failed.
Yeah, yeah. So how about the family? I think the family also get the impact of cause of the cervical cancer. What we call people with cervical cancer in the family. Not only the the woman can get the impact, but also people surround of people around the patient. Okay, okay, we can go to the next slide. Yeah. This is a true story, true other story. Yeah. How about your comment, students, about the story? So, the student, yeah, please share your comment. I think we can discuss. Yeah, it's not only one way, but I would like also to open the discussion from with the students. Yeah. How about the story in the yellow box?
From
from that story,
Mm-mm.
I felt cancer really affect our life, not only our private life, but also our interaction with other people and stuff.
Yeah. So, so you mean that the cancer can ruin or can destroy everything in our life? Yeah.
Yes.
Okay. So now, how about the story in the blue one, the blue box?
Can I give my opinion?
Yes, yes, please.
Hello everyone. So my name is Anaka from UiTM Bertam.
Yeah.
From the second blue box, I feel like this basically proves how important for us to have an early diagnosis, because we have to be aware that treatment can be very expensive. Especially if you notice it earlier on, and if you have early diagnosis, earlier treatment before the cancer spread and all, this can basically reduce the cost for treatment and basically save life of the patient before the cancer spread lah. And especially when that happen, everyone can be in a better state. There's not gonna be further burden on towards the patient themselves and towards the family who are possibly also helping to cure out the disease. So yeah.
Okay. Okay. Thank you very much for the student who give the comments about these stories. So I would like to show you about how big the impact of the cervical cancer, not only for the affected women or affected ladies, but also for all uh, all of the family, and also for the system, the health system. So that's why in the last story is mentioned about early diagnosis and so on. That this is very important in this for this cervical cancer or this kind of cancer. So in this slide, I would like to show you about what the Director General of WHO, Dr. Tedros, say that one woman dies of cervical cancer every 2 minutes in the world. But in Indonesia, I ever read that not in 2 minutes, in every 1 minute or a minute, one woman dies of cervical cancer. So it means that in Indonesia, cervical cancer is very, very what we call is the biggest problem. Uh, the most number of the cancer among female. So it's Dr. Tedros said each one is a tragedy and we can prevent it. So it means that as based on our story, as you know, actually the cervical cancer can be prevented, especially if the cases identified or diagnosed in the early stage, and there are many treatment that can be given for the cases. But the problems, uh, especially in the low income countries, included in Indonesia, not all of the examination can be provided in all what we call secara merata in Indonesia. So that's why this problem. The problem is to access the examination and also to access for the treatment. Okay, please the next. Please click, yeah. So from the previous slide also we can know that cervical cancer is preventable disease. It is also curable if detected early and adequately treated. And yet it remains one of the most common cancers and causes of cancer-related death in women across the globe. If we know, I would like to show you about the data in the world Maybe in the next slide. So please, yeah. This is the data that I would like to show you. Among female, there are many kind of cancer, but the number one is breast cancer, and cervical cancer put in the second rank after breast cancer. And please don't click it before. Yeah. Please come to the before. Yeah, the previous one. Yeah. From this slide, we can know in the blue one is about incident, and the red one is about mortality. But from this chart, we can see about cervical cancer, especially in low and medium high development index, or in low and middle income countries, more mortality, more death or more mortality, and also more incident of this type of the cancer. So as I mentioned in Indonesia, in the world, cervical cancer, the position of the rank is in the maybe in not in the first, but in Indonesia, cervical cancer, the position or the rank is in the first cancer, the first or the most number in among the kind of the cancer. So please, the next one. So I think this is the estimated from cervical cancer incident in 2018. So we can see here that the number is mostly in the ASEAN countries, and also in Africa. So these countries, if we see from the World Bank categories, is categorized as low income countries and low and up middle income countries. And we can see in America, and also in the Western Europe, the number is low, and also in Australia. Please. I think it's the same situation for the mortality. So it's the highest number in also affected people in the low until middle income countries. Yeah. Please, the next slide. Here that this chart that I said that I mentioned before, cervical cancer in the global, not put in the first rank, because the first rank is tracheal, bronchus, and lung cancer. In 2007, the position in the eighth number, and 10 years later, or into 2017, the number is decreased to be the 9 or the nin rank. So it means because in mostly, especially in the high income countries, they have a huge number of examination tests, and they provide what we call they provide everywhere, and every people can access the examination test and also the treatment. Yeah, so that's why in the global, in the level global, the rank is decreasing. Yeah, but in contrary, the situation is not the same, especially in low and low middle income countries. Yeah, please, the next slide. Yeah, I think it's the same. Yeah, so please. Yeah, in the global level, neoplasm or carcinoma or cancer, the position, the rank is in the second after cardiovascular disease. Yeah. So the next slide. Yeah. So now, what is the cervical cancer? Cervical cancer, yeah, please click, yeah. The cervical cancer is only affected women or female because in what we call as naturally, cervix is only have women or female is have only cervix or cervical, but not in men or male. So where is the cervix? The position or the anatomy of the cervix. The cervix is kind of what we call is categorized or is a type of our reproductive body, is a part of our reproductive body, and in the cervix is made of two parts and is covered with two different type of cell. The endocervix is the opening of the cervix that lead into the uterus. It is covered with glandular cells. And the second one, the exocervix or ectocervix, is the outer part of the cervix that can be seen by the doctor during a speculum exam. It is covered in squamous cell. We call it squamous cell at the place where these two cell type meet in the cervix. So that's why the cervix is what we call it's a meet between the one type of the cell and another type of cell. So this the cervix is we call it transformation zone. So this is a weak area. But in the other side, in the weak area for a woman, cervix is the way of the way when the woman is delivered a baby. So that's why one of the risks of the cervical cancer is the number of the woman is delivered a baby. So this is the picture. It's a kind of reproductive organ, yeah. This is the uterus, yeah. This is the uterus, and this is the vagina, and in this zone or in this area, we call it cervix. This one, yeah. So that's why in Indonesia we translate the cervix is leher rahim, because this is uterus, we call rahim, and this is part of the neck of the rahim. So that's why we call it leher rahim. So this is the consists of two type of the cell. So that's why this is a transition zone. So this area is very weak area. Yeah. Please the next slide. Yeah. So what is the causes of the cervical cancer? Yeah, please. We know that some genes control when cell grows, divide, and die. There are two types of gene, oncogenes, and another one is tumor suppressor genes. What is oncogenes? Oncogenes is gene that help cell grow, divide, and stay alive. And another one, tumor suppressor genes, is gene that help keep cell growth under control or make cells die at the right time. So if there is imbalance between oncogene and tumor suppressor genes, so cancer can be what we call can be growth. Yeah, can be growth. So why there is imbalance about between oncogene and tumor suppressor gene? There is a mutation in which DNA mutation, or we call it gene defect. So that's why cancer can be caused by DNA mutation or gene defects that turn on oncogene or turn off tumor suppressor genes. So why DNA can be mutated atau can mutate? We until now there is no specific specific or certain causa for explanation the mutation, but we know until now the knowledge that we know there are many factors to cause the DNA to be mutation. Yeah, please the next slide. I think please the next slide. Yeah, please the next slide. Arina, because I would like to know to show you about the risk factor for cervical cancer. As I mentioned before, till now we did not know why the DNA can be mutation, but from the many studies, many research, there are many factors that can cause DNA to be mutation. For cervical cancer, there are many risk factors. The first and also the first thing, and we believe until now is caused by infection. We call it human papillomavirus or HPV infection. And then the others risk factor is sexual history, such as becoming sexual active at young age, especially younger than 18 years old, and having many sexual partners, and having one partner who is considered high risk or someone with HPV infection or has sexual partners. So sexual history is very important for to identify if we find cases cervical cancer. And then the other risk factor is smoking, and as we know, then in cigarette there are many kinds of carcinogens. Yeah, so smoking, either active smoking or passive smoking, can be a risk factor for cervical cancer. And the others is having weakened immune system. I think, as we know, cancer is depend on the our immune system. And then another infection is caused by chlamydia. And the other risk factors is long-term use of oral contraceptive. I think this kind of risk factor until now is still debatable. Some research say that this can cause as a risk factor, and the other study or the other research cannot give an evidence to be a cause of cervical cancer. And also having a multiple full-term pregnancy, as I mentioned before, because cervical cancer is a way of deliver a baby. So having multiple pregnancy is a risk factor also. Young age at first full-term pregnancy is also a risk factor. Economic status is related to the nutritional status, and also the hygiene, personal hygiene of genitalia, organ genitalia. A diet low in fruits and vegetable, as we know, is also high risk for any kind of disease. Having a family history of cervical cancer, intrauterine device, IUD use, because IUD use, especially there is a tail, and a tail is can be a pathway for virus can be put into the uterus. Yeah, please the next slide. Yeah, please the next slide. So what is the symptom? Oh, I think we have to go back to the previous one for the symptom. Yeah. So I would like to show you about the symptom of cervical cancer. The most important thing for the cervical cancer symptom, this is we call it pathognomonic, or we call it very specific for cervical cancer, is postcoital bleeding. So if this this symptom is very specific for cervical cancer. If you have, if a couple get a bleeding after sexual intercourse, you have to consider the first in the first rank is about cervical cancer. And the other symptom is watery, bloody vaginal discharge that may be heavy and have a foul odor, and also pain in the pelvic area. And the sign and symptoms seen in more advanced disease can include swelling of the legs. Yeah, it's usually in the advanced cases, and problems urinating or having a bowel movement because the cancer have what we call spread of metastasis to other organs, to urinary, vesica urinaria, or metastasis to the back of the uterus, to the bowel organ. And also we find blood in the uterine. Yeah. This is the symptom of the cervical cancer. So please remember, if you find a vaginal bleeding after intercourse or sexual intercourse, you have to consider in the first rank is cervical cancer. Yeah, please the next slide. Yeah. So how about the preventive measure? The preventive measure, we have to consider first about the risk factor. So that's why the preventive measure can be no smoking, not only no smoking, but we have to give a systematic preventive measure. So we can advocate the government to have smoke-free area regulation or non-smoking regulation, and also the other side, plain packaging, and also the other regulation related to smoking is tobacco advertising, promotion, and sponsorship ban. And preventive measure, the other preventive measure is raise awareness about cancer. So you have, or we have to educate people, not only the adult woman or a lady or female, but we can start from to educate about the raise awareness about cancer. We can start from the girls. Yeah. And then elimination of the risk factors and HPV vaccination, human papillomavirus vaccination. I think every country have this program, but the problems is not everybody can access for the program. And the another risk, another preventive measure that is very important is screening test. Can be cervical cytology, colposcopy, and histopathology examination. And in Indonesia, we have a specific test for detecting the lazy earlier. We call it inspeksi visual asam acetat, or IVA test, because IVA test can be conducted not only for doctor or for midwife or for nurse, but we can train common people or the community to be examiner as and use IVA test, so they can detect lazy precancer earlier. And also the treatment, we have to provide the treatment for lazy precancerous and also for cancer. Please, the next slide. Yeah. So this is also about the preventive measure. We can see from here, as in the epidemiology, usually we have preventive measure to be three category or three kind of the preventive measure. The first one is primary prevention, and then secondary prevention and tertiary prevention. And the objective of the primary prevention is to prevent women to be sick or to be get cancer. So that's why we have in this level, in this primary prevention, such as vaccination and also education, to give education to raise awareness the people about risk factor, about the symptom of the cancer, especially about the raise awareness about the risk factor, so we can prevent the risk factor, and also we can keep our personal hygiene, especially in reproductive organ. And also in this type of primary prevention, we put male circumcision. How about the preventive measure in the secondary level? In this stage, the objective of this prevention is to detect the cases as early as possible. So that's why screening is very important in this part. And how about the preventive measure in this tertiary parts or the tertiary stage is provide all of the treatment, and the issue is everybody can access for the treatment. Yeah. Please, the next slide. Here I get the picture from the book produced by WHO. This is the National Cancer Institute in Malaysia. Maybe the student and also our colleagues from UiTM now the doctor or the person in this picture. Yeah. Please, the next slide. Yeah. So this from this chart or this picture, I would like to show you that all of the preventive measure is not a problem in countries from high income countries, but we have to concern about countries in the low income countries, because not all of the preventive measure can be provided by the government as a free. And included in the health system. We can see from here. This is the percentage of countries with HPV vaccine. This is the percentage countries with national cervical cancer screening program. Yeah, we can see here, and in the low percentage in the low income countries. Yeah, please. Yeah. So this is, I would like to show you about the target from WHO mentioned that in the next 20 years, we have to achieve 80% of the people can get a vaccine, and 80% of the women can have the treatment, and 70% of the women can have the examination. Yeah, please, the next slide. Yeah, I think we can skip this slide. Yeah, please, the next slide. Yeah. Yeah, this is the agenda for the WHO, what we call WHO have a program for all of the countries under WHO, under UN organization, that that they have to achieve this agenda. Yeah, please, the next slide. Yeah, I think if we can do the all of the program to elimination the risk factor, and also to give more people can access for the program, here the number of the cases and also the mortality will decrease, yeah, significantly. Yeah, please. Yeah, please, the next slide. Yeah, I think this is the same. Yeah. Yeah, I think this is the early detection, as I mentioned before, and also what we have to do in the secondary phase. Yeah, Yeah, please. I have mentioned before. So I would like to show you, can cervical cancer be found early? So as you know, in the first part of this presentation, uh, this this cancer can be identified earlier as possible, because there is a knowledge about how to screen the cases. Yeah. But the problem is the screening test, not all of the people can be access to the screening test, especially in the uh, countries in low and middle income countries. Please. Yeah. Yeah. I ever read in journal, in article published in the journal, what type of the event can be used to educate people. In America, in US, and in America, health fairs and parties are the most common special event to do screening for cervical cancer. So I think we have to identify also in Malaysia and also in Indonesia what kind of the event can be used to be as a what we call as a special event, to ask the people to come to the event so they can do a screening for detecting cervical cancer earlier. Yeah, yeah, please. Maybe in Indonesia, we have a posyandu. Posyandu is what we call is uh, a community empowerment or community activity provided is a pos. A pos we call is what we call pos ya. Apa ya pos ya? Lupa saya. But the post is provided by the community, and we the some of the posyandu provide, as I mentioned before, about IFA test, because IFA test can be conducted by a common people who will be trained how to do it and how to see the result by smear of the asam acetate in the cervix. Yeah. Yep. Yeah. Oh, I also find this qualitative this article published in the journal BMJ, I think, yeah, BMJ or BMC, yeah, qualitative exploration of Malaysian cancer patient perspective on cancer and its treatment, with the author from UiTM. Yeah, the study finding also provide ground information about the cancer patient knowledge of the cancer and perceived effectiveness of modern treatment, and can be helpful to design more cultural specific educational program. So I would like to show you that it is very important to fit or to match what kind of the event, or what kind of what type of the type of education, so that the people can know or can accept all of the information. So the culture is very important also to identify, yeah, in this effort to educate the people. Yeah, please, the next slide. Yeah, the next slide, please. Yeah. So this Dr. Taylor said, through cost-effective, evidence-based intervention, including human papilloma virus vaccination of girls, screening and treatment of precancerous lesion, and improving access to diagnosis and treatment of invasive cancer, we can eliminate cancer, cervical cancer, as a public health problem and make it a disease of the past. So this is all of the message said by the Dr. Tedros. Yeah, please, the next slide. The next slide. Yeah. So what we discuss in this lecture is also to achieve our commitment, our global commitment as we call it SDGs. So from our contribution to eliminate cervical cancer can be achieve SDGs number 1, number 3, and number 5, and also number 10. Yeah. Please, the next slide. I think this is the last one. Yeah, this is the reference I used for this lecture. Okay, thank you very much for the attention, and maybe you have any question. Please keep the question until the discussion session. Thank you very much. I give it to you, the moderator, Ibu Nur. Yeah.
All right, thank you so much, Santi, for giving us such a very informative and interesting presentation. So hopefully you guys able to grab whatever that have been presented by Dr. Santi. And don't forget to prepare your question, and hopefully that I can see questions from both of the universities. Okay. All right. So I think I will. Shall we move to the next speaker? All right, I will describe a bit on the background of the next speaker, who is Mr. Muhammad Hafiz Abu Samad, physiotherapy lecturer at University Technology Mara. He has received his bachelor degree in physiotherapy at International Islamic University Malaysia and taken his master degree at University Science Malaysia in clinical exercise science. Additionally, he was an athlete in swimming and squash and winning few medals in those sports. So allow me to welcome the next speaker, which is Mr. Muhammad Hafiz, to deliver his presentation. So Mr. Muhammad Hafiz, the visual floor is yours.
All right, thank you very much, Puan Syadana Akmal, our moderator for today. Respectable to as Director of UiTM Johor Pulau Pinang, Campus Pertama, Mr. Amir Ebad Abdullah, the Faculty of Health Science, UiTM Pulau Pinang, dan Dr. Ismail Ismail, Dean of Faculty of Public Health, University of Dr. Juni, Honorable lecturers and participants for the seminar. Assalamualaikum warahmatullahi wabarakatuh, and good afternoon. Today, I will give lecture regarding obesity and exercise. Okay. This is the outline for today's topic. We start with the introduction. So what is mean actually by obesity, and what parameters or indicators used to categorize the obesity. Next is prevalence of the obesity. I will explain prevalence of obesity and also prevalence of obesity specifically in Malaysia. And then we will go to classification of obesity. There is a classification whether overweight, obesity type 1, type 2, or obesity. And then what actually causes obesity, or let's say pathogenesis of the obesity. And then after we know about the obesity, we can further finish the obesity, specifically I will focus on exercise aspect. And then after that we can go for nutrition. So when we talk about this, what's on your mind when you see obese people? Maybe you can comment in the chat box what come across in your mind when you see obese people. How do you maybe you can share in the chat box to know what's on your mind when obese people across you. Let's see. Day to day. Obese people as cute. Okay. Slow metabolism of the body or less exercise. And yeah, usually we will see obese people will be having a lot of problem with stomach. Yes, fat people. Usually, for your information, usually in Malaysia, for men that have a big body, we used to call them BOB, stand for big of body. Okay, and like a nickname for people that are obese. So basically, is it obese or having no exercise, or maybe they just always watching Netflix. That's why their stomach getting bigger and bigger, or they just eat a lot of junk food, no healthy diet, and maybe they are lazy. So which one that actually contribute to obesity? We will know after this, okay? So as for introduction, what is mean by obesity? Obesity is actually a chronic condition or chronic disease, and it is characterized actually by abnormal or excessive adipose tissues, which contributes to numerous chronic disease and also early mortality. And the BMI is actually a tool used to classify overweight or obesity in adults. It is a simple index of weight for height, and it's defined by percent weight in kilogram divided by square of his height in meter, and it correlates significantly with the body fat, morbidity, and also mortality. So how about worldwide prevalence for obesity? Before we are going for prevalence of obesity, so your BMI is normal or not? Usually now they have BMI chart. Let's see for my case. My weight is 60 kilogram and my height is 175. So it's somewhere around 19 to 21 kilogram per meter square and fall within green zone. So meaning I am healthy and I am having a normal BMI value. How about you all? You can check your BMI by looking at this chart in the internet. So worldwide prevalence of obesity is a global problem and it's a reached epidemic proportion with at least 2.8 million people dying each year. According to WHO, World Health Organization 2016, there are around 2 billion adults who are overweight and more than half a billion were obese. Since 1975, the worldwide prevalence of obesity is nearly triple. And if this condition is not curbed, it is estimated that 2.7 billion adults will be overweight and over 1 billion affected by obesity, and 177 million adults severely affected by obesity by next 3 years, 2025. Ethic action to reduce the life. So how about obesity? Obesity in Malaysia is kicking time bomb because Malaysia has the highest prevalence of obesity among adults in Southeast Asia. In the 2019 National Health and Mobility Survey shows that 50.1% of Malaysian adult population actually overweight and obese. Why taking time more? Because obesity itself is a risk factor for the NCD like type 2 to diabetes, cardiovascular disease, and also several cancers such as breast cancer, large intestine cancer, and also kidney cancers. When compared to normal overweight individuals, obesity increase the risk of type 2 diabetes to 7-fold in men and 12-fold in human. This is very dangerous, right? To be close and more specific, it is one out of Asia who are actually overweight or obesity for the point of more than 25 and higher balance of overweight and obesity, and ethnicity has also highest prevalence compared to Malay and Chinese. For your information, there are three main ethnicity in Malaysia: Malay, Chinese, and Indian. And Indian seems to have a prevalence of overweight and obesity. The age group has high prevalence of overweight and obesity. The second ones, 1 out of 2 adults in Malaysia also having abdominal obesity. This is when the waist circumference of the person more than 90% in men and more than 80 cm for women. Prevalence also high in female. Same also high waist circumference in Indian ethnicity and also in higher age group, age 60 to 64 years old. Okay, when we compare between Southeast Asia, the overweight is the highest one goes to Malaysia with more than 35% of the population will have overweight. Compared to Indonesia, number 4. For the obesity, more than BMI more than 30, same, Malaysia is still number 1 with more than 12% of the total population is obese. And Indonesia also goes to number 4. So how we classify the adult underweight, overweight, or obesity based on BMI? Okay, this is the national classification of underweight, overweight, and obesity according to BMI from the WHO. The cutoff point, if the person is underweight, meaning the BMI is below 18.5 kilogram per meter square, and the normal range would be 18.5 to 24.99, and more than 25 is considered as overweight. And obese further classified into 3 classes. More than 30 to 34.99 is considered obese class 1. 35 to 39.99 obese class 2, and more than 40 is classified as obese class 3, or we call morbid obesity. But there is additional cutoff point for Asian. The underweight one is still the same, less than 18.5. The normal range for Asian is lower a few points from the normal range from the WHO. Alright, the normal point for Asian is between 18.5 to 22.99 kilogram per meter square only. If more than 23, there is increased risk, and it's already classified into overweight. Then more than 25 is already considered as pre-obese, and then further classification of obese class 1, class 2, and class 3 will be shown as follows. Right. This one is the more clear cut for the Asian BMI cutoff point. Why we have our own cutoff point, I will discuss after this. Usually we will our cutoff point reduce to 3 points from the current WHO BMI cutoff point. Obese class 1 range from 27.5 to 32.4 kilogram per meter square. Obese class 2 32.5 to 37.4 kilogram per meter square, and BMI more than 37.5, the individual is already considered as obesity class 3. And relate to the cardiovascular disease risk, the higher the BMI, the higher the cardiovascular disease risk. Okay, ethnic differences and obesity criteria. BMI value are age dependent and the same for both sexes. And BMI may not correspond to the same degree of fatness in different population due in part to different body proportion. This is one of the weakness of the BMI. So Asian population have different association between BMI, percentage of body fat, and health risk than do European population. So when we compare Asian with the Western criteria, only 2 to 3 Asian actually were classified as obesity. But Asian population have higher body fat at a lower BMI compared to Caucasian. That's why cut-off points for Asian is getting lower. For the same body fat percent, their BMI was 3 to 5 units lower to compared to the Caucasian, and the proportion of Asian people with high risk of type 2 diabetes and cardiovascular disease is substantial at BMI lower than the existing WHO cutoff point of overweight, which is more than 25 kilograms per meter square. Then we also, instead of BMI used for obesity classification, we also have additional parameters or indicators. The other indicators to complement the measurement of BMI to identify individuals at increased risk of obesity-related morbidity due to the accumulation of abdominal fat are actually waist circumference and waist hip ratio. For example, the waist circumference is divided by the hip circumference, where suggested as an additional measure of body fat distribution. The ratio can be measured and it provides index of both subcutaneous and also intra-abdominal adipose tissue. So how to measure waist circumference? You need to relax. Don't hold your breath. Okay. And then waist to hip ratio norms is good to have males less than 0.5, 0.9, and for female less than 0.8. Okay. This is the target from the WHO for Caucasian and Asian with circumference and also with hip ratio. For men, with circumference for men should less than 102 cm and women should less than 88 cm. But for Asian, men should have less than 90 cm waist circumference, and Asian women should have less than 80 cm circumference. And for waist hip ratio are not valid for children, people who are under 5 feet tall or lower than 152 cm, and people who have BMI of greater than 35 kilogram per meter square. Okay, WHO combined recommendation of BMI and waist circumference cutoff point made for overweight or obesity and associated with the disease risk. As you all can see, if men having waist circumference less than 90 cm and women with circumference less than 80 cm, the disease risk is increased when someone is having overweight, and the disease risk is getting high as the class of obesity is getting high. If with circumference more than 90 degree in male and more than 80 cm in female, further increase the disease risk in human. So what are actually the causes of the obesity? Obesity is just not eat a lot, sitting a lot. It is actually a result of a combination of quite something. It is a result of genetic, behavioral, environmental, physiological, social, and also cultural factors that further results in energy imbalance and promote excessive fat deposition. And the relative contribution of this factor has been studied extensively, and all the genes play an important role in the regulations of body weight. WHO consultation on obesity concluded two things, which are behavioral and environmental factors. For example, sedentary lifestyles combined with excess energy intake are actually primary responsible for dramatic increase in obesity during past 2 decades. So what is mean actually by sedentary lifestyle? Again, can you all share what is you know about sedentary lifestyle in the chat box? From the picture, I think you can guess what is meant by sedentary lifestyle. Let me see. Being a couch potato, lazy lifestyle, yes, very good. Unhealthy diet, watching TV and eat. Yes. That's activity maker. No physical activity, very good. No exercise, a lifestyle, little activity, lazy lifestyle, unactive lifestyle, unproductive, inactive. Yes, I believe you all get it. Okay. The specific meaning of sedentary lifestyle is actually a sedentary behavior, meaning any waking behavior like we energy expenditure. We are using energy, but the energy we use is actually 1.5 metabolites or less, while in sitting, reclining, or like now. We are in sitting and we are use energy less than 1.5 metabolic equivalent task. Okay, we are just sitting. This is one of the sedentary lifestyle or behavior. And then in general, this means at any time a person is sitting or lying down, they are actually engaged in sedentary behavior. Okay? Sedentary behavior, we all doing that, but we don't take it as a lifestyle. Okay, don't make it as a lifestyle. Okay, and then this is actually the max when we are doing sedentary lifestyle. Basically, we are using 1.5 max only, and we actually doing light activity, for moderate activity, 3 to 6 metabolic equivalent tasks, and so on. So again, for pathogenesis of obesity, the first one we go for genetic determinants. There is a genetic disorder For example, Prader-Willi syndrome, segment of the paternal chromosome 15 is deleted, which further can cause or lead to obesity. The second genetic disorder is Cohen syndrome, mutation of the COH1 gene, and then Carpenter syndrome, mutation of RAB23 or MHF8 genes, and also LMS1 genes, which further causes the person to have diabetes. Their genes problem lead them to have overweight or obesity. Leptin is one of the components that are important to have a society that stop eating. So I think in normal individual, as a receptor in the so it will increase. Okay, this leptin will counteract the effect of neuropeptide Y. So it will stop eating and enough to provide feeling of satiety, kenyang. Okay. Besides that, this leptin also will contracting the effect of anandamide, which is potent feeding stimulant, and further release of alpha melanocyte stimulating hormone, which further suppress our appetite and so that we can stop eating. That's leptin works in a normal individual. But leptin in obesity, obese individuals usually exhibit unusual high circulating concentration of leptin. So our body becomes resistant to the effect of leptin. So when there is sustained high concentration of leptin from the enlarged adipose tissue, and enlarged adipose stores implies leptin desensitization. So leptin jadi tak sensitive, and then it will flood pathway of leptin control in obese people. That's why they keep eating and eating without feeling satiety. Okay. Another pathogenesis of obesity is that enlarged fat cell, or we call hypertrophy, increase adipocyte size and also increase number of fat cells. Hypoplasia may increase adipose tissue mass through increased adipocyte numbers. And other factors that contribute to pathogenesis of obesity include increased calorie intake, level serving device, lack of physical activity, and also drug associated. But right now, everything is that's why we increase calorie intake, but reduce energy expenditure. So we also increase outside calorie free and increase fast food consumption also lead to increased calorie intake. This is example from the choose your portion. Level serving device, right now cellular phones, telecommunicating, food deliveries, make us just stay at one place and don't physical activity due to increased use of level serving device like automatic vacuum. For example, increased working time, driving instead of walking or cycling, and take up escalator or lift instead of walking upstairs. In some cases, obesity is also can be caused by drugs taken by a person. So don't judge people. They become fat or obese because of they eat much, but sometimes it can caused by the drugs they take. First one is antipsychotics, for example, phenothiazines, and haloperidol. Antidepressant also can lead to increased body size. For example, amitriptyline and trazodone, anti-epileptics, sodium valproate, carbamazepine, steroids, and also antihypertensive such as tirazosin. As for management of obesity, usually we go for conservative first. For example, lifestyle and behavioral changes, food and calorie restriction, physical activity and exercise, and pharmacological therapy. For the surgical one, usually vertical band gastroplasty, and is gastric bypass (GBP), also known as bariatric surgery, or in Malaysia we call ikat perut. Okay, right now we will focus to physical activity and exercise. Okay, next one, the obesity. The management of body weight is dependent on energy balance, which is affected by energy intake and also energy expenditure. For a person who is overweight or obese, to reduce the body weight, energy expenditure must exceed the energy intake. Must consider that. Okay, and a weight loss of 5 to 10% provides significantly health benefits, and these benefits are more likely to be sustained through the maintenance of weight loss and also participation in individual physical activity. So as an aspect of this management, I will focus on three. The first one is pre-participation evaluation. What you need to know before you engage in the exercise. The second one is exercise specific or exercise recommendation for the specifically for the obesity, and also innovative exercise approach. For the pre-participation evaluation, the exercise professionals should always incorporate some form of pre-participation screening or health appraisal prior to performing fitness testing or initiating an exercise program for an individual. It is goal to identify whether the person should receive medical clearance prior to initiate such program or not. Is it safe or not for the patient or for the individual to engage in the exercise. Number two, they will benefit from participating in medically supervised exercise program. If they need supervised, then we can give a supervised exercise program, and also to identify those with medical condition which should be restricted from participating in exercise program. If someone having a medical issue, then we should make sure they have a respected medical advice first before they engage in the exercise. Okay, this is actually the step-by-step process before individuals start in exercise. Basically, we need to know whether they participate in regular exercise or not previously. If no exercise were done by the individual, we need to know about the cardiovascular, metabolic, or any dental disease. If there is no any problem, and the person also having no any sign or symptom suggestive of the cardiovascular, metabolic, or renal disease, then medical clearance is not necessarily. So we can advise the individual to start exercise, but like to moderate intensity exercise only. If the patient already have cardiovascular, metabolic, or renal disease, but having no any symptom of it, the person need for medical clearance because the patient having no regular exercise before. So following medical clearance, if they can proceed with exercise, then they can proceed with the light intensity first. Okay. If there is actually sign and symptoms suggestive of cardiovascular, metabolic, or renal disease, medical clearance is also recommended. So following medical clearance, if you can proceed with the exercise, then we go for the light intensity first. If yes, but if yes, then the patient also having no any cardiovascular, metabolic, or renal disease and no any symptom of it, no any medical clearance is needed, they can proceed with the exercise, and the intensity they can start with the moderate to vigorous intensity. If they are having cardiovascular metabolic or renal disease, but it is no any symptom of it, they can actually proceed with the exercise. No medical clearance is needed. But if they want to progress for vigorous intensity, they further need medical clearance at least within the last 12 months. If there is symptom suggestive of cardiovascular, metabolic, or renal disease, whether they know or not they have that condition, they should discontinue exercise and seek for medical clearance. If yes, then they can proceed with the exercise. Okay, this is actually just details what is meant by regular exercise, cardiovascular disease, sign and symptom, medical clearance. When I say light intensity, meaning it is around 30 to 39% heart rate reserve, or rating perceived elevation 9 to 11. Moderate intensity 40 to 59% heart rate reserve, or rating perceived elevation of 12 to 13. And vigorous intensity, meaning more than 60% of heart rate reserve with the rating perceived elevation of more than 40. There is also self-guided method. Patient can also just fill in the questionnaire, for example, FAQ questionnaire, and also AHA, SMF, ACSM health fitness pre-participation screening questionnaire before they engage in the exercise program. So exercise prescription, basically 3 main exercise prescription for obesity. The first one is cardiovascular exercise, or I can say aerobic exercise. Number 2 is resistance exercise or strengthening exercise, and the third one is stretching exercise. For cardiovascular exercise, they have their own FITT, frequency, intensity, time, and also type or mode of the exercise. For the frequency, we have, based on ACSM, American College of Sport Medicine, we emphasize more than 5 days per week. So it is more 5 to 7 days per week to maximize the calorie expenditure. Intensity, if having no any medical condition, they can start with moderate to vigorous intensity. The exercise training should be moderate 40 to 60% of heart rate reserve. For the time, usually 30 to 60 minutes per day for a total of 100 minutes per week. And then they can progress to 300 minutes per week of moderate intensity and 150 minutes per week of vigorous exercise. So if you do moderate intensity only, you can prolong the duration to 300 minutes. If you do vigorous exercise, shorter time is needed, 150 minutes per week. Intermittent exercise is effective treatment, meaning if you are doing 60 minutes of exercise in a day, you can further split it into 3 sessions, 20 minutes rest, further 20 minutes rest, and the last session 20 minutes and rest. And the type, primary mode of aerobic exercise should involve large muscle group, meaning all cover up all muscle group in our body. No weight bearing and also weight bearing exercise, such as walking, swimming, and bicycling. So there are a few type of exercise that you can give to obese patients so that they don't feel bored to repeat the same type of exercise. Again, goals is actually to achieve regular exercise pattern. We want them to engage in exercise and they will enjoy it, so they can proceed with the exercise program. And then we want to achieve 60 to 90 minutes per day by the time of weight maintenance, and we want to create energy deficit of 500 per week. the person should expend 2,000 to 2,800 cal. And special consideration and comments, now wearing mode should be cycling, swimming. And then watch for indication of hypothermia. Hypothermia is actually abnormal high body temperature caused by failure of heat regulating mechanism of the body. So how we want to avoid this? Usually measure well ventilated exercising indoor, and also having loose shirt while exercise. Next is having enough water consumption. For the resistant exercise, we also go for frequency 2 to 3 days per week. Is the intensity same moderate to vigorous? How we want to know it is moderate or vigorous? Usually for moderate, we will use 60% to 80% of one repetition maximum. So the repetition should be 10 to 50 repetitions per set. So moderate intensity is actually when measured by RPE, resistive exertion. Is it the white one is the RPE scale within 11 to 15, meaning light to hard. The breathing or deep snare scale, and then the progression should be tolerated to maintain the rating perceived exertion of 11 to 15. For time or duration, usually we will do 2 sets with 2 to 3 minutes rest between each bout, and 30 minutes involving 2 sets for major muscle groups. For types of resistant exercise, patient can choose whether they want to have a machine types or free weights, elastic bands, or calisthenics. The first picture showing machine weight, and the lower one is actually free weights. And then cautions: do not continue to lift weight when you feel exhausted. And then the intensity of the last few repetitions will be close to your maximum. Also, the rise in your blood pressure may be too great. And then to avoid this, you should avoid hold your breath. Okay, this will lead to Valsalva maneuver. And if you are hold your breath, you can cause large changes in blood pressure. So breathing is important. Usually when you want to bring or macam tadi kata, lebih mudahnya sendirilah macam waktu nak angkat berat, contohnya nak angkat dumbbell. Waktu angkat, selalunya kita akan hembus nafas. Waktu lepas, kita akan tarik nafas. Okay. And then for the third mode is actually stretching or flexibility exercise. Frequency usually daily or following aerobic or resistant exercise. You can choose whether want to do it before or after exercise. Intensity stretch to the point of feeling tightness or slight discomfort. Timing usually 10 to 30 seconds per major groups muscles, and there are also few types of stretching, whether dynamic type of stretching, static stretching, or dynamic stretching. So and another exercise approach, instead of doing cardiovascular strengthening exercise, there is also one innovative exercise that are working to combat the obesity. The first one is HIIT, or I can say, or it is high intensity interval training. It is characterized by brief repetitions of high intensity exercise, around 50 seconds to 1 minute, and it alternates with the period of rest or low intensity exercise, between 1 to 5 minutes. And training at high intensity is superior to improve the cardiopulmonary fitness and also reduce percent of body fat in adults with obesity compared to traditional exercise. And number 2, women should encourage to have a morning exercise, whereas men are encouraged to perform evening exercise, because our studies found women burns more fat during morning exercise and men burns more fat during evening exercise, because it is believed due to differences in hormone, biological clocks, and also sleep-wake cycle sexes. So this is actually one of the example test program for obesity that I have created for my previous patients. We make test program 6 days of exercise, but we change aerobic and resistance exercise so that patient don't feel bored. For example, day 1 we have static cycling. For day 2 we do HIIT. Day 3 aerobic exercise by running. Day 4 HIIT. Day 5 aerobic exercise back to static cycling. And day 6 we do circuit training. Okay, and I think that's it. As for conclusion, obesity is a complex malrelation between energy intake and expenditure that results in homeostasis that is resistant to change. And obesity clearly has a negative implication that are well documented in consensus literature. Likewise, correction of body weight reduce the incidence of severity of comorbid disease, and a key aspect to this end is actually significant amount of exercise is appropriately supervised and quantified, and of course to combat the obesity. Thank you. I give back to
All right. Okay. Thank you so much for the interesting and amazing presentation. So I can see the box while the answering by the audience of participants. Okay, that's very good. Okay, so now shall we move on into the you can write in the chat box, or you can unmute your mic if you want to ask the question, or maybe if they have a lot of questions coming in, you can raise up your hand if I miss your questions in the chat box. All right. Okay, is anyone that want to ask about this Mr. Muhammad Afif just now? I'm actually quite scared when he showed this the what